Hi, I'm CJ. I'm 23 years old and I'm a medical assistant at a doctor's private office. I was thinking about going back to school to get my nursing degree, but I work full-time and I barely get paid enough to cover my bills and cover health insurance. See, I have this condition. It's called Wegener's granulomatosis, which causes inflammation in my organs, especially my lungs. I deal with it every day, but when I get a cold, man, I get a total bitch. Um, I have asthma, and I have this small defect in my heart valve. So, it makes me feel faint, and it makes me get really tired sometimes too. My condition is incurable, and I should be seeing a pulmonary specialist, but I can't afford it. My dad, he also has the same condition. He's a truck driver, and he and I both have high blood pressure. The cost just for 1 month's medication is $120 a month, and then that's with insurance. So anyway, about 6 months ago, I got into this car accident with a drunken driver. And I was taken to the ER, of course, and I had a concussion, some cracked ribs, and a lot of bruising. And I got a bill for about $2,000 just for one hospital visit. That doesn't include the money to spend on my car insurance or my car repairs. Doesn't include the ambulance ride, and doesn't include the actual doctor bill that will be charged on me later. Wow, it's awesome, right? So anyway, about a week later, I started getting these like major stomach pains. And I went to one of my coworkers, who's a nurse practitioner, and asked her for advice. And she freaked out. She was like, you need to get an MRI. And we have an MRI machine in our doctor's office, but I couldn't risk getting both of us in trouble with our doctors. So I went to the county hospital, drove myself to the county hospital, and I signed up in the ER to get seen. I waited for 10 hours. After 10 hours, I couldn't handle the pain. I drove another 5 miles to the private hospital, and I only had to wait there 2 hours. It was nothing. It was a torn muscle in my stomach, and it was fine. I was okay. There was no big deal. But now I have another hospital bill. It's $5,000. I guess what I'm trying to say is that, I'm really lucky because I work in a doctor's office where I can get stuff like free samples of medication, epinephrine shots if something happens with my asthma. But can you imagine if I didn't work there? How much worse I would be? I can't lose my job. It's just unfortunate that I can't get any help. The cost of insurance is rising. Doctors and hospitals pay outrageous amounts of money for a simple procedure. And people up on Capitol Hill can't even figure out how to compromise on healthcare reform. I bet you my left kidney that those government officials have pretty good health insurance. So for them, there's no rush, right? What's it to them if I owe the hospital $7,000 worth in charges? I'm not their kid, right? It just really sucks.